Good afternoon. I'm Stacy Murchison, Chief Marketing Officer at Chevy Chase Trust. Thank you for joining us for our COVID-19 medical briefing. We're pleased to be partnering this morning with Virginia Hospital Center and Dr. Rohit Modak, Head of Infectious Diseases. With the plethora and speed of the news reports about the current coronavirus surge, there's much to process and understand. And many have questions about how to keep ourselves and each other safe and well at this moment in time, as well as many other issues. So today, we're bringing you the experts to answer your questions. Here's how today's program will unfold. First, we'll hear from Jim Cole, President and CEO of Virginia Hospital Center, followed by a presentation by Dr. Modak. He will then answer your questions. We've received some by email already. During the program, feel free to submit your questions by using the Q&A prompt at the bottom of your screen. If we don't have time to answer all of them, we will follow up with you via email afterwards. Finally, to ensure best viewing quality, we've muted all audience members. Without further ado, I'd like to introduce Jim Cole, Virginia Hospital Center's President and CEO, who has been at the helm for more than 20 years. He has led the hospital center through its expansion from a local medical facility to a nationally recognized health system. Jim, thank you for joining us.
Thank you, Stacy, and thank all of you for giving us some time today. It's really a pleasure for me to have the opportunity to introduce you to Dr. Rohit Modak. Under Dr. Modak's leadership during this COVID pandemic, Virginia Hospital Center was the first to establish a drive-through testing program in Northern Virginia. We also were able to participate in the Mayo Clinic convalescent plasma program as a member of the Mayo Clinic Care Network. And most importantly, under his leadership, we are now designated as one of the 16 vaccination sites in the state of Virginia, and we're able to obtain the ultra cold storage necessary for the Pfizer vaccine. Dr. Modak is a board certified infectious disease specialist. He completed his fellowship at George Washington University Hospital, and he has been recognized by Washingtonian Magazine for several years as a top doctor. So let me turn it over to Dr. Rohit Modak. Rohit?
Thank you, Jim, and thank you to Chevy Chase Trust for allowing me the opportunity to speak. Wow, what a last 9 months it's been, right, everybody? I mean, we certainly did not predict this. So when asked to speak about coronavirus, there's different ways we can approach it. I can certainly give a scientific speech or, kind of talk about where we've been and where we're going. And I'll try to touch on some of these things. But, in general, as I look back 9 months ago, it was completely unknown. I remember actually I was visiting distant relatives in India over Christmas break last year. And on my plane ride home on January 1st, I remember getting an email from one of my professional organizations, IDSA, and there was a little note saying, there's an outbreak of pneumonia in the Wuhan province in China. And I remember looking up to my wife and saying, this is a little funny what they're describing here. This is something that may turn out to be something, but certainly I didn't predict what would happen, and no one did. And it's amazing where we've been. I don't need to kind of go through what has happened. Everyone remembers how the last 9 months have been and how all of our lives have been uprooted. But let's kind of figure out where we are now. So briefly, of course, in March and April and May, in the DC area, things were rough. All of our hospitals were overwhelmed, I would say. In our hospital, for example, we had over 100 patients on a daily basis with coronavirus admitted to our hospital. Then things kind of died down in the summer. There was a little bump, but really we were under control. And over the last month or so, things have been climbing again, and we see the news. It's doing this all across the country. Right now, in the DC area, we have, first let me talk about our hospital here in Arlington. We have about 70 patients hospitalized, which is the same number we had going back to May of 2020. So, it's been now 6 months since we've seen these numbers, and we're getting there and cases are rising. we often talk about percent positivity, and this is a really important number. So why is that? That tells us what's going on in our community. So out of all the tests we're doing, what is the percent that are actually positive? And it's true that the more we test, the more likely we're going to find people. But the percent positive is independent of the number of tests. So it really tells us are cases going up in our community. And generally, I've held this all summer that if cases are less than 5%, we're in good shape. That, okay, society can function on a somewhat normal level, although normal now is with masks and taking all these precautions that we never thought about before. And if cases are over 10%, that's where, wow, if that's the percent positivity, then there's real trouble and we need to be careful. And when you look at states in the Midwest or Wyoming or the Dakotas right now, the percent positivity is well over 50%. I mean, that's where it's crazy. Things are really out of control. So in the DC area right now, depending on your locality, our percent positive rate varies between about 6% and 15%. So in the district itself, in DC right now, it's about 6 or 7%. In Arlington, we're approaching 10%. In Fairfax, we're about 12, 13%. In Montgomery County, we're about 10 to 12%. So we are at that 10% or higher range in our community, and cases are going to go up. We talk about the Thanksgiving little burst that we're going to see in numbers, and that's because people did travel. If you've seen, our airports were just as crowded as they've been all summer. People did travel. They went, met their relatives. They were eating indoors without masks on. So absolutely, coronavirus was spread. And we're going to see this now a week and 2 weeks later, which is what we're getting into right now, that people are going to start to get sick. They're going to get tested. We're going to get those people in the hospital. So I expect cases to keep going up. So it's worrisome about where we're going to go. Things are better than they were in May in that we know more about the virus. It's not that we all of a sudden have any magic bullets, but we can handle it better. We know generally how to keep staff members safe. We know how to prevent transmission within our healthcare system. We know how to take care of people better. And our mortality, the number of people who die with coronavirus has gone down. Not because there's any magic medicine, although we have some medicines now, but generally we're better at taking care of people. We know how to approach it. So I'd much rather be where we are now than where we were in April, but it's still worrisome. You hear on the news the dark winter ahead, and that's true to an extent. We don't know what's going to happen. And I think one of the real problems is fatigue, and this is a real thing. We're all tired, and when I say we, I mean our community. We've done so well for 9 months. If you go out, I see people wearing masks all the time. Of course, there's some people who don't wear masks. Of course, some people say, I'm getting together with my friends, I don't care. But generally, especially in the DC area, in the immediate area, people are doing what they're supposed to. They're wearing masks. They're hopefully limiting their interactions with each other. But it's been a long 9 months. And I think with this rise in percent positivity, what once was safe, or maybe you could have a couple of people over and get away with it, it's not safe anymore because, again, the numbers in the community are that much higher. So we all need to be extra vigilant this time. So what's on everyone's mind? I'll tell you what's on my mind. It's the vaccine. This is what's in the news. It's very exciting. I just, before I came to work today, I saw a video of the first patient in the UK getting the vaccine, a 90-year-old woman actually getting vaccinated with this Pfizer vaccine. So let's talk a little about vaccines. And I'll try to be cognizant of not getting too scientific. But this is an mRNA vaccine. What does that mean? Well, mRNA, it's nucleic acids. It's the building blocks of life. It's related to DNA. And the idea is that we're getting this vaccine, and now our body takes this nucleic acid, this mRNA, makes a portion of the virus. We're not given the whole viral genome, not the genes that are in the virus, only a portion of it. It makes that into a protein, which it's supposed to do. And that protein is this spike protein, or the protein that coats the surface of the coronavirus. So our body produces it, and the idea is that this is not enough to get us sick because it's not the whole virus, it's just a little protein. And then our body sees this protein and says, wait a minute, that doesn't belong. We don't recognize this. This is something foreign. and then sends antibodies. It makes antibodies against this protein, and it figures out how to become immune. It says, if I ever see this protein again, now I know how to kill it. And that way, when we're exposed in the future, we won't get sick with coronavirus. So this is the idea. This has never been done before. So we've given proteins of viruses before, of bacteria before, your pneumonia shot, your flu shot. These are protein-based vaccines. But now we're actually giving the mRNA to produce the protein. So that part is new. Why? Because our technology is better. This is really something that could only have been done over the last 10 years, which is great. The genetic code was isolated for coronavirus in mid-January. It was published in one of our scientific journals by the Chinese scientists. And a month later, they started working on this vaccine. And here we are, less than a year later, and we have a vaccine, we think, coming to market. So that's incredible. The speed at which this happened is incredible. It's never been done before. So what do the studies show? Is it safe? It's something new. That's one of the most common questions I get from our staff. Dr. Modak, is this vaccine okay? Can I get it? We've never done it before. Is it safe? So what do we know? Well, there's two mRNA vaccines, one by Pfizer, one by Moderna. Both have shown a 95% efficacy. So let's kind of talk about that a little bit. So both studies were very similar. In the Pfizer vaccine, they tested 30,000 people, and the Moderna vaccine was 40,000 people. I'm going to lump them all together because it was similarly done. So out of 70,000 people, half of them got placebo, half of them got the vaccine. So we have 35,000 people vaccinated. Both are two-dose vaccines, so one at time 0, one either 21 days or 28 days later. So let's say within a month, they got the second dose of vaccine. And then they checked if, they basically compared the placebo group to the vaccine group. And they followed them one study was 1 month, one study was 6 weeks later after the first dose of vaccine. And they looked, and those in the placebo group, roughly 95 people got infected with the virus. And in the vaccine group, 5 people got infected with the virus after the 6 weeks. So because of that, we said, hey, there is a 95% efficacy. That means that you were 95% less likely to get coronavirus if you were vaccinated. And it sounds incredible, and the truth is it is incredible. This is a great number. This is better than anyone could have expected. And really, it's amazing. Now, does this mean this is going to cure everyone and this is great and we can go back? We don't know yet, right? We have data for about a month or two after the doses of vaccine. We're still very early on. So what's going to happen at 3 months and at 6 months and at 9 months? And we'll find out as we go along. But so far, this is as good as we could have asked for. So it's very exciting. What about safety? That's another question. This is a new vaccine. It's a whole new mechanism of action. Is it safe? So what do we have? We have 70,000 people, really 35,000 people who got the vaccine, and there's been no major side effects. So that's good. But what about the uncommon side effects? So we've seen this in vaccines before. For example, the flu shot. 1 in 1 million people will get a neurological problem. Yellow fever vaccine. Again, 1 in 1 million people may actually develop yellow fever. So the rotavirus vaccine, which we give our kids, 1 in 2 million people, 2 million kids may end up getting a complication called intussusception, a disease of the gastrointestinal tract. So things are possible, but usually when we're talking about these rare complications, 1 in a million, 1 in 2 million, we may not see it in the first 35,000 doses. So it's still possible that something can happen. It doesn't mean that it's not a good vaccine. When we talk about safety in medicine, we don't say absolute safety. We can't say, oh, this is absolutely safe, don't worry about it. We never know. We talk about risks versus benefits. And I think the idea is to consider the risks of getting the vaccine with the risks of getting coronavirus, because it absolutely will be protective. And I'll tell you, I don't have to, everyone knows coronavirus is bad news. It's not something you want to get. Even though we have treatments, the best treatment is prevention. Let's not get this in the first place. That's going to make all of us the safest that we can. So I'm very excited by this vaccine. The FDA is meeting this week. If things go well, it should be rolled out next week to healthcare providers. And we talk about phases, and the first phase is nursing home patients, nursing home healthcare workers, and frontline healthcare workers who are dealing with patients on a regular basis. So we expect in our hospital and a few hospitals in Virginia, and I'm sure Maryland is doing the same thing, DC is doing the same thing, that we'll have some vaccine, not enough for everybody, but at least for some frontline workers. And that's going to be the first step to protect all of us in our community. And then we roll it out in phases. So it's healthcare workers, then it's essential employees, which is our grocery store workers and our people who work in factories who are in close quarters. And then after that, it's our patients who are at higher risk. So our elderly patients, those with multiple medical problems, then the general population. So it will slowly be rolled out. More vaccine will become available, not just the mRNA vaccine, but then other vaccine like the AstraZeneca vaccine. Johnson & Johnson is working on a vaccine. And I think a lot of people ask me, well, which one should I get? I don't know that we'll have necessarily an option, that some will be shipped to different areas. And it's almost that you take what you can get, assuming all the data is good. And it should be. The way the FDA is looking at this vaccine is the way they've looked at other things. It's top-notch scientists really doing their due diligence and making sure that everything should be safe. So I'm very excited about the vaccine. And it's not all of a sudden a cure-all, because it's going to take months and months and months and months, probably 6 to 9 months to get the majority of Americans vaccinated. So we still have to wear masks. We still need to be protected. And again, even if I get the vaccine, it doesn't mean I'm completely immune. It means my risk is lower. And, I think everything with coronavirus is about risk tolerance. Why do we wear masks? Why do we get the vaccine? Why do we limit our interactions? It's we're trying to lower risk. And there are going to be some people who say, well, I'm not going to wear a mask. I'm more risk tolerant. And they may not think of it in those terms, but that's really what they're doing. So be it. But believe me, let's be risk averse of the situation. Coronavirus is not something you want to get. Finally, I want to talk about how to stay safe, because this is the other question I get asked most often and have been asked for the last 9 months. Dr. Modak, how can we stay safe? What can we do to stay safe? And it's very easy to say, oh, well, don't just stay in your room and lock the door. And of course, you'll be safe if you do that. It's the same thing I tell some of my young patients who say, how can I protect myself from STDs or HIV? Well, yeah, you can be abstinent. That's number one. But some things are not realistic, and we need to really look at things and say, what's reasonable for people to do? So with coronavirus, I've come up with an algorithm. It's MODAK, M-O-D-A-K. So let's kind of run through that. M, mask. We all know about masking, right? Masking works. There were a couple of great studies, actually, that showed this. There was a case in Korea it was in a Starbucks. 4 employees were all masked. Everyone in the restaurant, in the Starbucks, was not masked because they were all enjoying their coffee. Someone with coronavirus was sitting right under a vent, and that vent was basically blowing all of their breath out into the restaurant. Out of the 45 people in the restaurant, 35 people got coronavirus, and who didn't? The 4 people masked, the employees who were there. Masking works. There's another great study about a hair salon in Missouri that the stylist was actually sick. She was wearing a mask. She cut 60 people's hair. They were all wearing a mask. None of the clients got it because the source was masked and the clients were masked. Masking works. So again, everyone should wear a mask when they can. Oh, outdoors. If you can be outdoors, that's much better. Why? Because the wind will take this away. I can't tell you about the magic of outdoors. And I know it's cold right now, but as much as you can, get those fire pits going, whatever you can do. Put on your big jackets, layer up, go for a walk with a friend. That's fine. If you're outdoors, that's 100 times safer. That makes things a lot easier. D, distance. We all heard about this back in March, socially distance, right? This virus, a little bit is airborne. Most of it is droplet. So when you talk, when you breathe, that's traveling about 6 feet and then dropping off. If you can stay at least 6 feet away, you're going to be much more safe. A, avoid large crowds. So whenever you have a large crowd, people are going to get closer together. That's just the way it works. There's more likely that someone in that crowd is going to have coronavirus. And of course, the crazy thing about this virus, you don't have to have symptoms to transmit the virus. So people think they're healthy, they get together. The more people you have, the more likely someone is positive, and that's going to spread. And finally, K, know the risks of those around you. So if you're meeting up with someone, and I heard this a lot in Thanksgiving, well, my brother is coming to town, but he doesn't really mask that often. I don't think he takes it that seriously. Guess what? If he's not masking, he's much more likely to have coronavirus. And that means you're much more likely to have coronavirus. So it's so important to really know what's happening around you. It's not enough to say, well, I'm going to mask. It's what is my neighbor doing? And am I getting close to them? And then the general rule of thumb, out of the MODAK, out of the top three, the MOD, mask outdoors distance, if you can do 2 out of the 3 of those at any given time, so you can mask and be outdoors, you can be outdoors and be distanced, then maybe you don't need a mask. If you can do 2 out of the 3, generally you're going to be safe. There's always exceptions, but that's a rule of thumb that will generally keep you safe. And with that, I think I'll end my presentation. And of course, I'm very happy to answer any questions. I hope you see I'm very passionate about this stuff. I love talking about it. I really enjoy infectious diseases, sharing information, and I'm happy to answer your questions. Thanks, guys.
Thanks, Dr. Modak. That's terrific. We appreciate all your helpful information. We have gotten a few questions. Will or can a vaccinated person who is exposed to COVID transfer the virus to others?
What a great question. And I'll tell you why it's great, because it hits on a lot of things. The first thing I'll comment on is there's a lot we don't know. So this is a new virus, and it's a new vaccine. And as we go about seeing how people respond, then we'll know the answer. So the short answer is we don't know. So when you get a vaccine, the idea is that you're going to get an antibody. Now you have an antibody. So if you're exposed to the virus, no problem. My antibody is going to come and fight it, and my immune system will take care of it so I don't get sick. But does enough land in my nose and my throat that it's still secreting, that it's not causing me to get sick, but I'm still, when I cough or talk to someone, I'm still secreting the virus? We know there's asymptomatic transmission. We know if someone's symptomatic, they're more likely to transmit it. So I think your risk of transmitting the virus to others is lower if you're vaccinated, but we can't say it's zero. That's why it's so important to continue precautions, continue to mask, continue to take these standard precautions, because we don't know. We don't want to infect our friends and family.
Great. How about this? Why does the vaccine need to be kept at 80 degrees below Fahrenheit? Aren't all vaccines dead viruses? And if it's live, can it change the genetic makeup of a human?
Okay, so it's not a live virus. So some vaccines are dead virus. Some vaccines are dead virus components. Some vaccines are live viruses. With coronavirus, no one is working with a live virus to make a vaccine out of any of the candidates that are being developed right now. But why does it have to be stored? So it's not stored at such a low temperature to preserve the virus. It's actually, the way it works is the mRNA is delivered to your body. So you have this component of the gene. That's surrounded by a protein shell. And that protein shell is supposed to now get into your body and then go into your cells to deliver the gene. And then that gene is replicated, and we call it translation. It's made into a protein and so forth. So in order to deliver that whole mechanism safely, that protein shell, that's what needs to be stored at -80. That's Pfizer's technology. Moderna's technology says, okay, we need to store it at -20 degrees because they have a different proprietary technology. It doesn't mean one is better or worse. The real juice is what's inside that protein shell. But the storage is different, the temperature is different because of that protein shell that each company has developed.
Okay, great. If you have had COVID, can you still transmit it to others?
So it depends when you've had it, right? So how long are you contagious for? Generally, for someone who's healthy, we think you're contagious probably for about 10 days. And that's why the CDC says that if you've had COVID and you're feeling better, you don't have fever anymore, and you're feeling a little better after 10 days, you're not contagious. You can come out of isolation. But everyone's different, right? And what if your symptoms last a little longer? And what if your immune system doesn't work quite well? So we know for some transplant patients or whose immune system is lower, it can take, people still secrete active virus for weeks and weeks. And that's why there's oftentimes, we try to be extra careful. Generally, it's going to be 10 to 14 days. I'll tell you, in our hospital, I've made a rule that if you're positive, you stay on isolation for as long as you're in the hospital. And of course, we can look at each case and assess something, but again, the goal is safety overall for everybody. So, so it should be a short time, 10 to 14 days that someone is contagious.
Thank you. So there is quite a wide variety available in the marketplace of masks. Some are very stylish, some are not at all. But we're curious about, what is the best type of mask that we should be using?
Okay, so that's another question I get a lot. What is the best type of mask? So really, the mask does three things, I would say. It prevents you from spreading coronavirus. So if you're talking, your secretions are blocked by the mask. It prevents other secretions from getting to you. So you're protecting yourself, wonderful. And it also prevents you from touching your nose or mouth, because we often have a bad habit of just reaching and scratching ourselves or touching our face a lot. And that prevents that from inoculating yourself from our hands. So masks can do that third part very well. Any type of mask will do that. But it's really the first two. And they've studied this. They've said, okay, if I cough with a mask on, how good is that mask at protecting my droplets from flying across the room? The best mask, I would say, is a surgical mask. And that's what they sell. They sell this everywhere now, these blue masks, right? These are good because they work in a couple of ways. Number one, there's multiple layers inside this. It's actually 2 to 3 layers inside. It also works by static electricity, you could think of it. That if the virus gets in there, it's actually trapped inside because of the layers. That's why multi-layer masks are so good. In the beginning, we didn't have these masks. We said, save these for healthcare workers because we didn't know what was available. And we said, use cloth masks, use a 2 or 3 layer cloth mask. That's still very good. That prevents droplets from going, it limits it to about 1 foot in front of you. These might be 6 to 8 inches. Those might be 1 to 1.5 feet, which is fine. That's what we're looking for. Any multi-layer cloth mask, any surgical mask is fine. I don't think you need to get into the weeds about which is a little better. They're all going to do the trick. What is not good are those bandanas, those gaiters that you pull up. Those are usually 1 layer. They've been shown not to protect. You need a mask like this. And don't be shy to wear it. It's excellent. I get a question a lot, well, what if I'm outdoors? What if I'm exercising? Do I need a mask? And it really depends on who's around you. If you're outdoors, truthfully, if you're walking by somebody, you're not going to get coronavirus even if they're positive. If you're next to someone the whole way and you're 2 feet apart going for a walk, maybe you do. Because remember the Modak rules in the top 3, you need to do 2 out of 3, outdoors, mask, and distance. So if you're outdoors, that's great. But if you can't distance by 6 feet, then wear a mask.
Okay. We've had a couple of questions about the best protocol to follow for quarantining and or testing before gathering with a few people, say for a holiday.
So let's talk about testing first. Should you get tested before meeting people? I never want to say no. Testing is always a good thing. Having more information is good. If you test and someone's positive, wonderful. That person hopefully will be discouraged to come to your big gathering and will stop the spread of the virus. So testing in that way is excellent, but we have to be really conscious of what testing means. Testing doesn't mean I'm completely clear. You could have 10 people get tested, go to an event, and the next day someone turns positive, and that means everyone is exposed to the event. Testing tells you basically if you're contagious on that day. So we know people exposed to coronavirus on day 1. They get tested on day 4. It's negative. They feel fine. They go to an event on day 7. And then day 8, they start getting a fever and feel unwell and get tested, and now they're positive. Guess what? Everyone at day 7 on your event is now exposed. So you have to be very clear. So testing is better than no testing, but it doesn't mean you're completely fine. So just be very aware of that. And the second thing you asked is, what about quarantine? How do we do that? So if you're exposed to someone, you get a call, someone at work was positive and you did share a space with them, and now we could say you're a PUI, a person under investigation. You were exposed. You need to quarantine for 14 days. That's CDC guidance. What does that mean? That means ideally stay home. If you're married, stay in a separate room from your family, unless they're also PUIs. But even so, one of you could get it, one can't. Can you stay in separate rooms? Can you stay in separate can you use separate bathrooms? Can you wear a mask in your house? These are things you should do. The idea is that you may be contagious at any time. You may be transmitting coronavirus at any time, and you don't want to give it to your loved ones. You shouldn't be going to work. You shouldn't be out and about meeting friends. If you can avoid it, you shouldn't go to grocery stores. You should really just stay home.
Okay, there are a couple of questions about the long-term effects of COVID. We've heard about mysterious symptoms like brain fog, blood clots, and tremors experienced by patients who have recovered from COVID. Have you had any patients that have had similar experiences? What do we know about the long-term effects?
Sure. So that's a good question. And we hear about this a lot, this long COVID syndrome, long haulers. I think we need to be a little careful because there's not a lot of data on this, but there certainly are cases. And what happens is these cases get a lot of press coverage. And then because it gets press coverage, more people come out and say, oh, I think I have something. And then it gets more press coverage. So it's a never-ending cycle. So it may be a bit overblown. When we look at the data, this absolutely does happen. There were two studies I can bring up. There was one study that looked at people in Italy. And remember, in Italy, they had a horrible outbreak back in February and March. When they looked at people who were hospitalized, so sick patients who were very sick, it turned out about 50% of people had some symptom at day 28, so a month later. And that symptom could just be fatigue. It could be a cough. It could be shortness of breath. It could be brain fog. It could be a number of things. About 20% of people had more than one symptom. Again, these are people who were older. The average age was 56, and hospitalized. So sicker patients, and we say about half had some symptom. Now think about this. If you ever had the flu, if you've ever had a bad pneumonia, a cough, many of us do have symptoms a month later. We still have a lingering cough. It takes a while to get better. So is this really out of the ordinary? I mean, certainly there's some people who, yes, it absolutely is, but maybe it's, I think we just need more data. There was another study in the US that looked at people who, it was actually more younger people who were infected with coronavirus, and about 20% had symptoms on day 21. So again, let's look at the other way. What does that tell us? That tells us 80% of people who have it will be fine. We'll make a complete recovery with no problem. That's what we expect. Yes, there will be some people with brain fog, with fatigue, with a cough. We don't know what to do with these people. We don't think it's not viral replication. It's an immune response. We think of this virus in two phases. There's the virus itself, which replicates and causes trouble. And then a lot of the trouble is your immune response. When you see people on the ventilator who are sick for weeks and weeks, it's because your immune system is almost out of control trying to fight this virus. When you get clots later or heart attacks. So what do we do for that? And that's being studied now, but truthfully, we don't know. And this is a big area of research. We're going to learn a lot more as the weeks and months and years progress. And, maybe it turns out to be nothing, or maybe it turns out to be everything. And it's something that we're just not too familiar with at this point.
So I have some 20-somethings at my house, of course, and they're asking, if you are basically asymptomatic when you contract the virus, are you therefore, based upon what you're saying, you're therefore less likely to have any kind of long-term effects?
You're less likely, Stacy, but as we talked about, it's a risk profile.
Right.
So less likely doesn't mean you're not likely.
You're not off the hook. Right.
Yeah, and that's the problem. We just don't know yet. In fact, there was an interesting study of athletes at Ohio State University. This was published in one of our medical journals. They did MRIs of the heart. So just looking at the heart muscle itself of athletes who you think are the best of the best, as a college level athlete. And it turned out about 30 to 40% of them had inflammation of the heart muscle about a month later, after COVID. And they didn't have symptoms. Some were asymptomatic, but 30% had had evidence of heart inflammation. And does that mean anything? Does that mean they're more likely to have a heart attack down the road? Does that mean nothing, that they're just going to get better and it takes a while? We don't usually do cardiac MRIs on athletes, so we don't know what a normal is, but certainly we don't expect to see this kind of inflammation that we saw. So it's interesting. There's certainly something about this virus that's worrisome. And I would take it very seriously. And that's why I think vaccine is so important. And the benefits really do outweigh the risks.
Absolutely. We have a couple of questions about those who have tested positive for COVID and whether they should get the vaccination as well. If you've tested
I think it's reasonable to do so. We don't know if testing positive, if having the virus means you're immune. It doesn't look like people get the virus again in the short term, in a month or two, but we don't know. And people who get the virus are also now quarantined. They're isolated, and hopefully their behavior changes a little bit and they're not out there. But we really don't know if that's immune. We don't know if that means they can't get it again. With the vaccine, we think that this produces an immunity at least for 6 weeks or 3 months. That's what our data shows us so far. So yes, I absolutely recommend those who've had coronavirus or who have antibodies to coronavirus do proceed with the vaccine if offered.
Okay, thanks. There are a couple of questions about distribution of the vaccine and whether or not the DMV is creating a coordinated response. What's your vision of how smoothly this distribution of the vaccine will be?
Right. So I don't think people are looking at the DMV as a specific area. We're doing it by state. So kind of the way it trickles down is that the vaccine is being delivered, and it'll be delivered to our hospital or to different areas, but it's through the health department. So our local health department, whether it's Arlington County Public Health Department, Montgomery County, or DC Department of Health, who do we answer to? In Arlington County, they answer to Virginia Department of Health, the state health department, who then kind of answers to the CDC. That's the hierarchy. So the state is in charge. So the state says, okay, we're getting 700,000 vaccines of this Pfizer. Who has a freezer, first of all, because it has to be stored at -80. So 20 people raised their hand. They said, okay, then they looked at that and said, well, Arlington, you have a freezer and you have this many healthcare workers and this is your population and this is what's happening in your community. We think you should get 1,000 doses of the vaccine to start. And we think Fairfax should get 2,000. And we think, Rappahannock County should get 500 if they have a freezer. So it's like that. It's coming from the health department and then to our local community. And now we're in touch with our public health department, Arlington County, to talk about, okay, well, who needs it in our community? Of course, it's our healthcare workers. What about our EMS? What about our nursing homes? What about physician offices who are not affiliated with our hospital? How are we doing that? So we are coordinating with our local health department. I think that's what a lot of places are doing. It'll be done on a local level, but not across state lines, not from the district to us, nothing like that.
Okay, not the region. Okay, great, thank you. Another question about with the currently increased positivity rates, is there a reason to postpone non-urgent medical appointments, dentist, regular eye doctor, etc.?
So that's an interesting question. And my short answer is no. The reason is that back in March and April, where everything was shut down, there was absolutely a reason to cancel everything. And the reason is we didn't know how this was being transmitted, where you were at risk. And in a dentist's office and an eye doctor's office, you're at close contact with someone. So you have to be careful. But now we know how to protect ourselves a lot better. So now when I see patients in the office, they come in wearing a mask. I'm wearing a mask. We are staying 6 feet apart. So even if one of us are positive and we don't know it, I still feel it's a very low likelihood that the other person will get infected. When you talk about dental office or eye doctors, that's much closer contact. And oftentimes, let's take a dental office, you have to be without a mask. So there is the higher risk. I advise my dental offices, the dentists, the practitioners, to really make sure they're masked well, to put full, we call it PPE, protective equipment on, which means not just a surgical mask, these N95 masks, a face shield. They have to be very careful. Truthfully, if there is something that's truly elective, you don't need to go, and you could stay at home for another month or two, it's something to consider. Because it's not just going to the doctor's office. When people go, they go out. Oh, I'm out anyway. It's running into people, on the street, in the waiting room, they're going to stop for lunch on the way. Then they're interacting with other people. Oh, maybe I'll stop and get something at the grocery store. It's a lot of interactions on the way. That's actually why I'm really not a fan of travel at this point, air travel. It's not so much that the airlines are not safe. I think when you're on a plane, you can wear a mask. If they make others wear a mask, the ventilation is good. It's everything leading up to that. It's that Uber ride in. It's waiting in the terminal. It's waiting on the jetway. It's having thousands of people pass you. You don't know if everyone's wearing a mask. And I'll tell you, we often see people wearing a mask like this, right? Not covering their nose. That's not protecting. It has to be over their nose and mouth. And some people, it slips. Some people don't know. And it's dangerous. We need to be careful. We can only protect ourselves. And I would limit elective travel if given the option.
Okay, so as a sidebar, yeah, we just received a couple of questions about taxi rides and Uber rides. Are you suggesting not to use Uber and taxis right now?
So I think if you can avoid it, it's better. If you want to, keep the windows down. Now, again, I haven't been in a taxi or Uber recently, so I know they have some barrier now, and I don't want to say it's unsafe, that maybe they've taken good precautions, but in general, keep your mask on, have that person have a mask on, keep windows down.
Okay. We have a question about pets. Can pets carry the COVID virus?
We don't know. At first we thought no, then there was a study out of China that showed there was a pet dog who did have the virus. There's been no known transmission between humans to pets to humans. So it's unlikely. We don't know the full answer to that, but it doesn't seem like there's transmission.
Okay. Another question about donating blood. Is it safe to donate blood during the pandemic?
So donating is not a problem. That everyone uses sterile needles, that's fine. They also screen the blood for antibodies. We don't think this virus is really going to live in the blood supply for a long time. So receiving a blood donation, if people are getting transfused, they need that blood for a reason. So I wouldn't shy away from that thinking you're going to get COVID.
Okay. I think we have covered just about everybody's question at this point. I'm looking at the Q&A. We have a couple more questions about air travel. What are the risks of air travel? You have addressed that. I think we have actually covered all of the questions.
Okay.
There's one more coming in. Hold on one second. Is it safe to send clothes to the dry cleaners? Worried that virus-infected clothes may be on the premises before cleaning.
So I think it's completely safe. And in fact, one thing we thought about in the beginning was how much of this is going to be spread by droplets, by fomites. So, you get your groceries, you get food delivery, it's on your clothes and you're handing it off to people. And that has really fallen out of favor, meaning it's not likely to happen. So when I get a delivery, I don't let it sit for an hour. I don't wipe everything down. I do take my food out of my delivery bags, wash my hands, and then I eat. But I don't do anything, I don't wipe things down like that. And with clothes, I go to the dry cleaner, drop it off, pick up my clothes, and I'm fine with that. It's not going to live on surfaces for a long time.
Okay, and there's one last question about elective surgeries. Many were being postponed. What is the situation with elective surgeries at this point?
So currently we're still doing elective surgeries. I am telling my surgeons when they ask, I say, you know what? I don't know what's going to happen in the next week or two or month or two. So if you have a patient who needs to get something done, let's get it done. And oftentimes elective surgery is not really elective. Elective means, okay, I don't need to do it today, but I probably need to get this done in the next month or two. So I would still push those people to have surgery today. I think a hospital is a very safe place to get things done. As numbers go up, things may change and it may not be safe. And the way it works is usually it's the governor who issues an order, let's stop elective surgeries. Until that happens, we're also looking at it as a hospital system too. We're not just waiting for the governor to do it. If we think it's unsafe to have patients come in and do surgery, we'll say that. And I'm certainly not shy to tell, my administration, hey guys, this is not something we should be doing. But so far we have not had transmission in a hospital setting. So we're not seeing people get the virus in the hospital. We're all wearing masks. We all take precautions. I think it's okay to proceed with elective surgery for now.
Okay, great. We have a couple more that have come in. Dr. Modak, I hope that's okay. We have one about, should we wash our faces as well as our hands, or is it just the hands?
you should wash your hands. That's how things are going to be transmitted. Of course, we should all wash our faces, but in general, to prevent COVID, we're wearing masks in general, right? Is some droplet, everyone else is wearing a mask. Is some droplet going to land right here above my mask and now it's highly unlikely. So I wouldn't say that's necessary. If something happens where you think you are exposed, sure, wash your face, but generally it's hands. Hands are how things are transmitted. You grab a doorknob after someone else did, you don't know what's on your hand. Washing hands, using hand sanitizer, those are great ideas.
Terrific. Thank you so much for this amazing information that you've passed on and the time that you've spent with us. We're so grateful. And if anyone has a question and wants to reach out to me, I can coordinate with Dr. Modak to try to get your answer and get back to you. So we want to thank you so much and thank our audience members for joining us today. We're delighted you could be with us, and please stay safe and stay well, and we will be with you soon.